welcome everyone to Me Eternal Live. My name is Kenya Gibson from iHeartRadio. Really excited to be up here today with some of these folks who've already actually been on my podcast. So Cynthia was on my podcast about this time last year. I feel like it's been a whole year. And I just want to say thank you again to Dr. Jan Katz-Nelson for your support and putting this event on. Your team has been super supportive of the Me Eternal platform and educating women and communities of color about fibroid health. So can we just clap it up again for Dr. Katz-Nelson?
Woo!
Yes.
Can we just clap to Cheryl Chambers and all her
Cheryl
team?
made this all come together.
Cheryl and Jonathan!
Very hard to make it happen. Thank you.
And we're also joined up here by Dr. Jacob White. And I kind of wanted to start with Mallory and Cynthia because you're both sisters, right? And there is a family history of, fibroid, right? So can you just talk a little bit about like what that experience was like, how you all kind of found out what was going on, and then what you got to in terms of like coming to the point that you felt like you were sharing some of the same symptoms?
Okay. All right. Well, I'm going to take it back. Our mother, Barbara, had fibroids as well. But, that generation, I don't think she was ever really diagnosed with fibroids. She just suffered, and she went on to have a hysterectomy, which set off a lot of other different issues in her health journey after she had that done, because it was actually not necessary to have a hysterectomy, but she didn't have USA Fibroid Centers and Dr. Jan and all this good information and, platforms and situations like tonight where you can come and learn more about fibroids. So with that said, I first found out about my fibroid when I was pregnant with my now 24-year-old daughter, Noelle. And I was pregnant, and what I remember is my doctor telling me, "Oh, you have a fibroid." And I was like, "Oh my God, I'm, a little dramatic. Am I going to die? What's happening? It's cancerous, whatever." She's like, "No, girl, it's not." But it is there, and she just made me feel like it was no big deal. So I was like, "So I don't have to do anything?" She was like, "No, it's fine." What she didn't tell me was that this thing was going to continue to grow in my body. And for me, I only wanted one child, so, as far as me, wanting more children, that was not a part of my personal story, but I do know that it would have affected me as my fibroid grew bigger and bigger, because at the end, when I had UFE, uterine fibroid embolization, it was like the size of like a large orange for sure. And then I had like 2 or 3 other ones that were a little smaller. But at that point, I was constantly on the celebrity baby bump list. Everyone was always thinking I was pregnant because I always had this bump. I was totally anemic. And actually, you didn't mention that as being one of the symptoms, and that was one of my biggest symptoms. Like when I could tell you all the best ice spots in Atlanta, the gas station, the hospital, and they were like, "Girl, why are you at the hospital?" Because they got that good soft crushed ice over there. Like, I need to come and get some of this ice. Like, I was like, you would never not catch me with a cup of ice. I was very, very severely anemic. My sex life sucked. It was painful. I never wore white. What else? I don't like to throw the word depression around, but I was definitely in a dark space because I was tired all the time. My cycle would go as long as like 10 days, sometimes 10 to 12 days. So I was either on my period or getting off my period. So anyway, long story short, again, that was just a part of my life and my reality. And I was like in my early 40s once I found out about uterine fibroid embolization. And I did not find out this information from my gynecologist. I would go and get my checkup. And that was something that was never even checked. And finally, I was like, why am I bleeding so much? Why am I always bloated? I started asking questions. And to be honest, she wasn't that helpful. She just was like, "Oh, maybe you have fibroids. You should maybe look into having a hysterectomy." And I was like, well, damn, that's extreme. I got to go straight to a hysterectomy? So then I started doing my research, and then I heard about UFE, which is basically a very simple procedure, like Dr. Jan said, that basically stops the blood flow to the fibroids. And I literally went in, filmed it for Housewives, fought with them to film it because they were like, "Well, we don't know if that's great TV." I was like, well, it's happening to my life. I am a reality star. This is like me walking in my truth. And to be honest, everyone on the cast except one person was dealing with fibroids. They just didn't talk about it. And now everybody's talking about it. Even some of the ones that was dealing with it then, now they're talking about it. But anyway, I'm just glad the conversation is still going. So one of the best things that I did, when I go anywhere in the world, you guys, when I tell you out of all the craziness that I've done, well, I wasn't that crazy on Real Housewives of Atlanta, but I'll just say anywhere I go in the world, women come up to me and thank me for talking about fibroids, because so many of us, especially African-American women, are dealing with fibroids. And even the husbands, shout out to the men that came tonight, because what I will say, like, when we're not happy and we're miserable and we don't feel good and we're tired, we're going to take it out on y'all first. So you guys need to be here getting this information and understand what your partners are going through, because we're not just mean. We're not just mean. We do want to have sex with you. We do love you, but we just don't feel like it if we're dealing with fibroids. We're not ourselves. And these fibroids, these non-cancerous tumors are inside of us, and they literally drain the life out of us. And, as women, we do the most. And it just makes life so much harder when you just don't feel good. So I encourage all of you tonight to please get checked out. This is not something that your OBGYN is going to ask you if you have. You have to ask those questions. You have to continue to get information. And that is why, although I'm on the other side of fibroids, I'm like, well, I'm on the other side of menopause at this point too. But anyway, I don't deal with them anymore. But I do feel like it's important for me to keep the conversation going. So
that's so good.
That's my story, and I'm sticking with it.
So out of the two of you, who found out that they had fibroids first, and then what was that support system like for you both?
I found out I was actually 3 months pregnant, and I started bleeding. And I was actually in Greece. So I made an appointment with the Greece doctor. He basically told me that I was for sure having a miscarriage, and he told me I had fibroids, which, of course, at the time I never heard of that. But he said it's non-cancerous, and he said that at the time he said 85% of black women get this, and he don't know why. So I flew home, saw my doctor in the U.S., and she confirmed that I did have fibroids, 3 fibroids. And she gave me 2 options, hysterectomy or have them surgically removed. I told her hysterectomy is not an option because I was trying to have kids. I had the surgery. 2 years later, I had another miscarriage. So pretty much battle with the fibroids, trying to get pregnant, all that, because I had fibroids and they kept growing back very quick. So I used to complain about you 24/7, complaining that, oh, my periods are so heavy, heavy, heavy. I had to change like every 10 minutes. And I was telling Cynthia about it because I would miss a lot of the family functions, didn't really want to be around anybody. And she said, why don't you just have them UFE? So she had it first. She had UFE. So I had it first. And I didn't know about UFE. So she made the call to US Fibroids and said, hey, you need to get this taken care of because it's like it really took control of my life. So I flew to New York, and I met Dr. White. When I say amazing, amazing. A 30-minute procedure changed my life. No more bleeding. So I am so thankful. I don't even know why you took so long to do it, but I'm thankful.
Okay, well.
I complained for 2 years, by the way, before she made that call.
I know what I don't know. Look, I'm just glad you got it done, yeah. But I don't know what happened in that time. I was not trying to keep the fibroid people away from you, okay? I was not. But I will say there was just such a change in, Mal, as a person. Like, I literally just stopped even inviting her to stuff. Because once I got myself together, I was like, back outside and like having a good time. And I'd be like, hey, girl, we're doing this, we're doing that. You want to come? And she's like, oh, I don't feel like it. And I'm tired. So I just was like, okay. So finally, I did get to the point where I was like, do you still have them? Like, what's going on? Why don't you just get it taken care of already? So finally, she's on the other side of it. So we got 2 different versions of how it went down. But I would have led you over to these people a lot quicker. So
that's so good. So I want to get a clinical perspective for a moment here and just kind of pivot to Dr. White and Dr. Katz-Nelson. In terms of what you see in communities of color, right? And what do some of those treatment plans look like, and what are some of the misconceptions that you see when it comes to treating the women that you've seen so far?
So maybe I'll start first. So there's interesting misconceptions. I'm still learning, and I'm shocked. We tried to advance, right, for 7, 8 years with the Fibroid Fighters, and I asked Cheryl in our marketing department, why can't we go to congregation, to churches, and try to do that? And we tried. We gave a fair effort, and it didn't work. I didn't know why. I mean, we saying in almost perfect English, with mild accent, what's going on, and explaining. And we have 39 locations in New York City alone, and we're in 30 states. We work 7 days a week, extended hours, covered by insurance, like telling about access to care, phenomenal care, no comparison. Women thought that they were punished by God. Women thought that they've done something wrong. It's like we were talking past each other. And so it's not about treatments. Let's solve the first misconception that it's not your fault. And after that, if it's not your fault, what do we do about this? So you don't have to suffer. You didn't do anything wrong. You don't need to be punished. And after that misconception that it's normal, everyone had it. Because it's such a common thing, and everyone suffers and kind of suck it up, move on, and life is difficult, so what? It's something, and normalizing abnormal, it's terrible. Another misconception that it's fibroids is okay, not a big deal. It is big deal, it's huge deal, because you basically, not knowingly, wasting your life. 2 beautiful, smart, amazing women suffered so much, and they had all access to information to the best doctors. They didn't know. Can you imagine everybody else? And next misconception that hysterectomy is not a big deal. It is a big deal. You basically castrate yourself, and it's terrible. And everything, uterus, actually important part of the body, not only for babies, but also holding things together in the bottom. You remove it, everything falls down. And there's no orgasm, right? The same, because there's no contraction of the uterus. Everything falls down. 9% of women, because of the pain after procedure, end up with the dependency, drug dependency. And there's a lot of other surgeries need to be done to suspend and prevent, bladder and other organs, to make sure that there's no incontinence. It's a very nice word for leaking different things. So it's not benign. So many misconceptions. And another misconception that nobody knows about interventional radiologists, specialists that actually do that. Gynecologists don't treat fibroids. Minimal invasive way. Somebody else. And that's why I want to give, some opportunity for Dr. White to tell his story and how easy that can be done. So, magician, Dr. White.
Woo! Thank you.
Thank you. Thank you. It's so great to be here again. I love coming to these events. It's great seeing everybody. Thank you all for coming out. Just to talk about the medical aspect of it, you've already said how many women have fibroids. In addition to that, half of at-risk women don't even know what fibroids are, and on average, it takes 3 to 4 years to get their fibroid treatment, just like Cynthia and Mallory were saying. So because of that, Jan created USA Fibroid Centers, open access. We bring women in and we treat them. And we treat them with this incredible procedure called uterine fibroid embolization, or UFE. It's very quick. It's done in the office, not in the hospital. We can give a little medicine to relax. The patients don't feel anything at all. The whole procedure is done through a tiny needle hole in the wrist or the leg, and that's it. No cutting, no scars, no stitches. Through that little hole, a little tube goes on the inside. The patients don't feel that. And then we inject the fibroids from the inside, cut off the blood flow to the fibroids. Okay? It's real quick, takes 20, 30 minutes. We watch the patient for a little bit, and then they go home. There's some cramping afterwards for a few days, and then they feel fine. Yeah. After that, the fibroids shrink down dramatically. The pictures on the ultrasounds and MRIs, really, really dramatic. The fibroids, they shrink down, they soften up, and all those symptoms get much better. The bleeding, pain, bloating, the anemia, everything just goes way down after we've treated these fibroids.
Can I say this really quick? I think this is important. When I had UFB done, I had it done that morning. And the next day, and we filmed it, and the next day I had one of my castmates come over and check on me. So I had like a little half day out, but I was feeling completely fine. Like the next day, I could have actually gotten up and gone to work. So I just want you guys to understand just how easy and quick it is. And I will say my periods went from like a good strong 8 to 9, 10 days to like 4 days. And I feel like that happened in like maybe a couple of months that I saw a change. And then after almost probably a year, and maybe it was less, I was no longer anemic. So, and I was feeling better. And I was wearing white. And I was like, my stomach was flatter. Like all of the different symptoms that I was going through was life-changing. So you do not have to suffer from this in silence. Like you really, really don't. Like nobody deserves to just not feel good. And if you are suffering with fibroids, you are not feeling your 100% best. I can tell you that right now.
And I kind of want to close out there and just ask both you and Mallory, why do you think as Black women, we are so strong, we're so stubborn sometimes, and like culturally, we don't always have these type of conversations to advocate for ourselves?
Well, for me, I think, you know, as a Black woman, I feel like we kind of feel like we're like super women. And we feel like it's just required to just have to just work and just put our health and ourselves second. You know, I feel like we often, and I'll speak for myself, and if anyone can resonate, then great. But I always felt like, you know, if it's not hurting me, I don't really have to go to the doctor. I mean, it's fine. I mean, I can just deal with it or whatever. And I never really put myself and my health, my wellness first. And I can just tell you right now, that's some bullshit, okay? We need to put our health first. And we need to start now. And I started late. I started in my like late 40s. I'm well into my 50s now. And health is my number one priority at this point. I'm at every doctor's appointment, every checkup, not on time. I'm 15 minutes early at this point because I understand that health is truly our wealth. And I want to, you know, as you get older, when you start, you know, getting a little older like me, no matter how you take care of yourself, you're just getting older and you just have to just do a little bit more to feel good and to have energy and to, you know, just live your best life. I know it looks amazing on Instagram, but I really be over here struggling sometimes to even get up to take the picture, okay? I'm like, I got to put something on Instagram. I got to do it. And it's just, you know, for me, I love women and I love women empowerment. And I want anything that if I'm going through it, if I'm going to get any kind of checkup, I'm going to share it with you guys on Instagram. I like everything that I do because I really want. Because I was one of those people who would like be like, oh, I didn't get my breast exam. Okay, how many years has it been? And you know you guilty of it, for sure, ma'am. I'm just going to call you out.
Really? I
So
go every year.
anyway, it just like, you know, it just takes such a village to just help lift each other up because we just get caught up. We just get busy and we just be doing the most and we just really honestly put ourselves second a lot. And I would encourage all of you to please make your health, no matter what your age is, start earlier. Please start earlier than I did because it will give you so much more joy and such a better quality of life to just feel good and know that you're happy and healthy.
For me, I'm a very private person, so I was actually embarrassed about it. So I didn't share it. I shared it with my sister because she's my sister, but I didn't share it with anyone. So
She's an Aquarius. She's like a vault. She don't.
Right.
When I tell you, you ain't gonna know nothing that's going on with Mal. So, go ahead.
So you know, so I felt uncomfortable talking about it back then.
Even to me.
So that's probably the reason why most people, we're from the South. We don't talk about periods, sex, and stuff like that. We're just private. So I feel like a lot of people, you know, in that, you know, they just don't want to talk about it.
Yeah.
You know, it's not a pleasant
And that's
subject.
true. That's true. That is a good point. A lot of women do feel embarrassed to talk about it. And one of the great things for me with being on a TV show, we just talk about everything on Housewives. So I was like, we talk about everything else. May as well talk about this too. So that is a good point. But you don't have to be embarrassed. And it's not like fibroids are sexy and hot to talk about. Like, hey, I got fibroids. I'm over here like bleeding all over the place, and I'm all bloated and I'm anemic. Ain't nobody trying to talk about that. But I will tell you, just like how much time and conversation has changed that whole narrative. Like, I remember being one of the, if not the only celebrity on TV talking about fibroids, to like, now everybody I know is talking about it. Like, at this point, I'm like, okay, well, now wait a minute. I need y'all to stay in y'all lane. I'm the fibroid lady. Not over there booking everybody. I'm like, wait a minute. I thought I was over here talking about fibroids. But I really love that women feel more comfortable, and especially women with a platform, to, you guys are following us and, inspired and motivated by us. So we should share not only just the good stuff, we sharing everything else. Let's really share, some of the more intimate things that, could help someone else get the information and the help that they need.
Yeah, that's great. And what I will say is collective conversations like this help extend a platform and help us all to have a platform. So you should all clap for yourselves for coming here this evening and be willing to be a part of this conversation. And I kind of want to pivot over here to Dr. Jan Katz-Nelson, and just how do people get in touch with USA Fibroid Centers? What would be a good next step if someone is experiencing symptoms?
So you can find us at usafibroidcenters.com, usafibroidcenters.com. It's very easy. If someone suspects that they have problems, it's very easy to schedule an appointment online or just call. And what you should expect is a simple ultrasound study, because it's a tumor, so we can see it. It's visible on ultrasound, which is basically waves, sound waves. No x-ray, nothing dangerous. It's a 5-10 minute ultrasound, transvaginal, transabdominal, and we know the answer. In rare cases, we'll ask for MRI. Also, no radiation, very simple thing. And right away, we can fix the problem, ask insurance for approval. It's all covered by insurance. And
yes, that part.
People ask few things about treatments. Will it work? Yes. Will it hurt? Very little. And will it cost? Covered by insurance. So if you have answers on all these questions, nobody should suffer. I will tell more. There's a law in Florida it was a Fibroid Research and Education Act. Senator Gibson passed it 2-3 years ago, and that's fibroids is a disease that basically counted by the state and in a database like HIV and anything else, because it's so dangerous and debilitating. So it needs to be public emergency, public problems, and they cover preventive ultrasound, like a wellness ultrasound, without copays and anything else. So in my opinion, every woman should get ultrasound periodically, because if someone has an 80% chance to develop disease and the symptoms, they grow slowly, it's very difficult to kind of think, oh, now it's a problem. Before it was just a long, not a good. So do ultrasound, and then it's very simple to connect the dots. Now I understand why I have a back period. Now I understand why I have a pain. Now I understand what I cannot function. And then learn about UFE and stop suffering and enjoy the best life you can have. Thank you.
Yes, thank you. And so I appreciate everyone being up here today. You're listening to Me Eternal live on iHeartRadio. I am Kenya Gibson, and until next time.
Thank you, guys.